A filler is an injectable used to add volume and replace volume loss in certain areas of the face. For example, laughter lines, hollowness in the under eyes, mid-face, or temples. It can also be used to enhance certain features like plumping up the lips with lip fillers, nose bridge enhancement, and cheek and chin enhancement. At Dr. Yvonne Goh Aesthetics, we use fillers to improve overall facial proportion to achieve the optimal balance. Today, most fillers are made of hyaluronic acid. These are synthetic volumizers made in sterile preparations. There are many viscosities referring to the thickness or fluidity of fillers available in the market. When correctly selected, it can give you the optimal boost to problem areas. There are also many brands available in the market. For example, Juvederm, Restylane, Boulevard, the list goes on. An experienced physician will be able to select the optimal filler type for your face. Fillers are often used as an anti-aging treatment to replace volume loss in certain parts of the face. It can also be used to enhance facial features by improving minor imperfections. It does improve overall aesthetics by improving proportions and balance in the face. Fillers are administered with very fine needles, with a quick procedure with hardly any downtime. It's a quick procedure administered by a very fine needle. It is generally very well tolerated. The fillers these days mostly come with lidocaine, a numbing agent, which makes the process more comfortable. Advanced techniques of fillers are now being used with cannulas, which are blunt tip. This actually enables us to distribute the product better. It's safer, more comfortable, and also a much reduced chance of bruising. Filler results are immediate. They generally last about 9 to 12 months. Some filler types can last 1.5 to 2 years. Yes, for whatever reason, if you want the fillers removed, there is an enzyme solution called hyaluronidase that can be used to accelerate the natural breakdown of fillers made of hyaluronic acid. An experienced physician will help you select the optimal filler type that best suits you, and also the correct volume of fillers to use for a natural look. It is important not to overfill, but to use subtle amounts of fillers in strategic areas to give you a more natural lift or enhancement. You can always start with small amounts and top up later rather than put too much in at one go. Less is always more in this case. In certain cases, we also combine Botox and fillers for a more optimal overall result.